In this session, we're going to continue our discussion of the nurse-patient relationship, and we're going to focus on medication errors and risk reduction. The objectives of this session, we're going to talk about and define medication errors and identify factors that can contribute to errors. We need to understand the impact of errors and describe methods for reporting and documenting, very important. We're going to talk about nursing interventions and teaching information that you're going to do to reduce errors. And then we're going to explain strategies used by healthcare organizations to reduce errors. Medication errors are any preventable event that may cause or lead to inappropriate medication use or patient harm. So there's a couple of different factors that can lead to errors. They can be on the health care provider side of the house or maybe the patient caregiver side of things. So let's talk about the healthcare providers. Errors happen sometimes from omitting one of the rights of drug administration. You know, your 6 rights of medication administration: right patient, right medication, right route, right dose, right frequency. You admit one of those, and that could lead to a med error. Um, Another one is overriding agency system checks or working around the computer. You don't want to do that. That can lead to an error. Also, on the health care provider side, failing to take into account for patient variables such as age, body size, renal or hepatic function. So as the nurse, you need to look at all of those things. You need to ask yourself one very important question with every medication you give is this medication appropriate for my patient in dose and frequency, based on their age, their renal function? You need to look at all of those factors. Errors can happen by giving medications based on verbal orders and phone orders. That is why the process now is not to do a whole lot of verbal orders or phone orders. Errors can happen that way. Also, giving medications based on an incomplete order or illegible order. So, incomplete order, you don't have the right med, the right dose, the right frequency, the right PRN actions. That could be a problem. Back when we used to physically write orders, and some places still do, they would be hard to read. What plays into that also are those unapproved abbreviations. So you just want to make sure you know what abbreviations not to use. One very important factor with healthcare providers is practicing under stressful work conditions. So I'll give you an example. A lot of places have a common medication room. Every nurse is going in there trying to pull their medications to pass their medications at 9 or 10 o'clock. People are standing in there talking. By the way, every good nurse has one of those work phones on them and they're ringing. Those type of things, those conditions. I may have 7 patients that day and they need a lot of medications and that's stressful. So those factors could lead to errors. For patients and caregivers, some factors are taking drugs prescribed by several practitioners, and we see a trend in this with the opioid crisis. Or another, maybe more even specific example, I have a primary health care provider. I go see a GI doctor for one thing. I go see a nurse practitioner for something else. If they're all prescribing and I'm getting medications from different providers and the providers are not in the same loop, the patient may have, there may be med errors on that part. Getting prescriptions filled at more than one pharmacy. So, we can jump right to teaching. We're going to talk about that later. Have your patients use one consistent pharmacy. Not filling or refilling prescriptions. Patients and caregivers, there's many reasons that go into why they don't get filled or refilled, but that leads to errors. Taking medications incorrectly. Oh, well, the bottle says 1 time a day, but for good measure, I'm just going to take it twice because I think more will be better. That could be an example. Taking leftover medications. I hope your brain just said, what medication do people tend to not take fully? or maybe save and leftover and use for the next time. And I hope you are thinking antibiotics because that does tend to happen. Start on an antibiotic sequence. After a couple of days, I feel great. It says take it for 14 days. No, thank you. I'm going to hang on to this for next time. So that could happen. And then another issue could be taking medications prescribed for someone else. So we always do want to teach our patients, please not to do that. All right, the impact of medication errors. So when you think of a medication error, a lot of times we ultimately think directly to the patient. We don't want to cause any patient harm, but um, there's some other things that happen when medication errors occur. One, it's the common cause of morbidity and preventable deaths in hospitals. So patients do die because of medication errors, and it's preventable. It is emotionally devastating, and that I will tell you, nurses, from the nursing perspective, when you make an error, and I don't wish it into anybody's professional career, it happens. There is an emotional toll and a process that goes with it. Increased costs, and the increased costs are going to come from maybe potential consequences. If I make a medication error and I give a client a double dose of maybe an antihypertensive and now their blood pressure drops, so now I have to give them another medication or a bolus to revert that, that costs money. Maybe they need to stay in the hospital another day because we need to monitor them to make sure they're okay, increase their length of stay, and again, that's just overall costs. The damage to reputation can come on the nurse side sometimes, and as well as the organization. Um, Although we say we don't want any, we want to be able to self-state med errors, and we don't want to be afraid of them, but we may feel that our reputation as a professional registered nurse could be damaged, or maybe our organization, a patient's perception when they're doing those HCAP surveys, and or they're doing any type of discussion. Well, I went to XYZ hospital and they gave me the wrong med, or they gave, it could have a damaging effect that way. The penalizing of administrative staff because of errors. We don't want a penalizing system. We really do want, and I speak predominantly nursing, nurses to self-report when they make an error because otherwise we don't know how to fix them. There's fear of being penalized, fear of being reprimanded. Even administrative levels outside of you're a staff nurse, but you have a charge nurse and you have a nurse manager and you have administration in the organization. There is a fear of damage to that. Any error should be investigated and it should be subjected to analysis to determine the cause. And that is the most predominant takeaway we want when we speak about medication errors. They do happen, but we want to get them investigated because ultimately we don't want them to happen again. With regard to reporting and documenting errors, always want to report. Do not think that there is a medication error issue that is too small. Even as I gave the medication at 8 a.m., but it wasn't due until 10 a.m., that's a med error, wrong time. So you report and document all medication errors. Now, you're going to document in the medical record as well as probably most likely complete an incident report. In the medical record, you want to document and include specific nursing interventions implemented after the error to protect the patient. You want to document all individuals that were notified of the error, and you want to give details of what medication was given or omitted in the medication administration record, or the MAR. When you're doing an incident report, and this will be a separate document, not in the medical record, you only want to record factual and objective items. So always state the facts, state it objectively. This allows the nurse to identify factors that may have contributed to the error. Again, we got to go back to the why it happened. Incident reports are not part of the client's medical record. They're used by the agency, actually risk management, to improve quality improvement processes. That your accurate documentation is going to verify your patient safety. And remember, incident reports are tools to improve medication administration processes. So when we talk about med errors, we also got to talk about sentinel events. And this is an unexpected occurrence involving death or serious physical or psychological injury or risk thereof. Sentinel events are always investigated. We need to make sure that there's interventions to ensure that this event does not happen again. And sentinel events will have what's called a root cause analysis, and this is an entire analysis process. It seeks to prevent another occurrence because the root cause analysis is going to ask what happened, why did it happen, and what can be done to prevent it. All right, so now we want to talk about, well, how do we reduce errors from ever happening? Because that's the ultimate goal. We just don't want medication errors to happen. So, think of this in the nursing process. Um, think about maybe the assessment piece and thinking, what could you do? Assess your client's allergies to food and medications. If we know about their allergies and we get an order, if my client says I'm allergic to morphine and it causes me to have an anaphylactic reaction and the provider orders morphine, hey, we don't need to give that to the patient. You let the provider know if they have an allergy to morphine. Nowadays in the computer system, it usually is triggered in there, but I will tell you, orders do still happen when it comes to allergies, especially with medications. Always assess the client's health concerns currently so you know that the medications are appropriate for them. Always ask about over-the-counter and herbal supplements. Um, Clients may or may not know that if they take aspirin and they're taking another medication, that could kind of nix out the effect of the medication they just got ordered. Or they may not know, hey, I heard this thing called St. John's wort was beautiful. I need to go ahead and take this. I'll just tell you, there's so many contraindications with that in every medication. They may not know because somebody told them this herbal thing was really good. And I'm not negating herbals and supplements. We just need to know about them and be very careful. We're going to talk more about that in another section. You need to look at a client's lab values. All roads lead to the nurse when it comes to medication administration. You are the last stop before that pill or that injection or that IV goes to the patient. You need to look at their lab values and make sure that the medication you are giving, that the lab values are appropriate for that. Every medication has lab values you need to look at. You need to make sure that their kidney, liver, and other body functions, make sure everything's working properly. That's going to tie into the lab values. You need to do your head-to-toe physical assessment. If a client is disoriented and confused, and maybe that's not their normal, but they have maybe some medication that could cause disorientation and confusion, your assessment should say they're already confused. This medication is going to make them more confused. I need to stop for a minute. I need to go talk to the provider and clarify. You want to identify needs for education, and we talked about this in the last segment. I can't tell you how important that is. Um, how do you prevent errors? You avoid using abbreviations that can be misunderstood. And there are a lot of abbreviations that can be misunderstood. So if it's a do not do not use abbreviation, do not use it, not even on your own personal notes, because you could get in a bad habit of using an abbreviation that's unapproved. If you feel that an order is questionable or it is unclear in any way, shape, or form, it is your due diligence to question that with the provider. Some orders very explicit, very detailed. Some orders for medications, maybe not so much. If you think anything needs clarification, you need to ask. Do not, unless you are working in an area that specifically says you can, verbal orders can cause medication errors. It can cause a lot of miscommunication, misunderstanding. So please do not try to use verbal orders unless your agency says so. You need to make sure that you follow all policies and procedures. Again, don't do any workarounds when it comes to administering medications. If you're trying to scan that barcode on that package and it won't scan, you need to get a new medication with a new package so that it will scan. A lot of times nurses will be like, well, I'll just document it independently and not use the scanner. What you've just done is not followed a policy and a procedure, and you've done a workaround. That could lead to an error. When you are teaching patients, please make sure that you get understanding from clients, especially. Try to not have distractions when you are delivering medications. Although it is very hard to do that, but there's a ton of literature out there, and people have done studies on it that distractions during medication administration really leads to a higher incidence of errors. If you can remove the distractors, I think I mentioned earlier those phones that our units give us. If you can, turn it down a little bit lower. Maybe tell your charge nurse, hey, I'm going to go past meds now. Um, Unfortunately, we still carry them around with us. But if there's anything you can do to reduce distractions, try to do so. When you're administering medications, you want to focus solely on that task. It's hard when you're in the patient's room because they're going to talk to you, the family's talking to you, and I'll give you an example. I had a med error, and I was giving the medication, and at this time, the facility didn't have scanners. So, you didn't have that little safety measure. And the family was talking to me, and then my work phone rang, and ultimately, I was supposed to split the medication, and I didn't split the medication. So they got double what they needed. So that was a med error. I could have eliminated by that by not having those conversations, easily saying, "Oh, we want to have a conversation. Give me just 5 minutes. Let me go ahead and do this really quick, and then we'll go ahead and I'll sit down and talk with you." I did change my medication processes after that, which is typically what nurses do when we do have an error. Um, you need to make sure you practice all of the rights of medication administration. Right patient, right medication, right route, right dose, right frequency, right documentation. Don't ever deviate from those. If you deviate from those, you're putting yourself at risk for an error. So just keep in mind, always identify your patient with two means of identification. Use the correct procedures for all routes of medication administration. Don't do a workaround. If you're calculating dosages, do that beforehand. Take your time, double check yourself, and get someone else to check your math. Always document on the MAR immediately at the point of care and document any additional information, follow-up assessment afterwards in a timely manner. If you are giving your clients oral medications, you must make sure that they swallow those medications. Be astute to long-acting oral dosage medications, and they are going to have abbreviations, and not really abbreviations, but LA, XL, or XR. They're going to be in those names, so just be astute for those. And then, as always, be familiar with your look-alike, sound-alike drugs, because those can get mixed up very easily. You always need to make sure that you assess your patient for the expected outcomes. If I'm going to give a client a blood pressure medicine and their blood pressure is elevated, the expectation is that within a designated time period, depending on the route of administration, that their blood pressure is going to come down. You have to reassess and evaluate that to make sure that's happening. You need to watch for adverse effects. And this is very most important if a client is taking a medication for the very first time. And this happens a lot with antibiotics. People just don't routinely take vancomycin at home, all the time. If I'm in the hospital with an infection and they order me an antibiotic, this might be the first time I have ever taken it. So therefore, as the patient, I need to let you know that. And then as the nurse, you need to watch me because I may have a reaction and you'll have to do other interventions. Let's see, nurses and errors. You should be familiar with the frequent types of drugs and drug errors and the severity of reactions. Now, I don't have a whole list of this. I don't want you to memorize this as you are moving along in your clinical practice, and you will begin to identify common medications of drug errors and why they happen and what type of reactions happen when those errors happen. You should never, ever administer a medication unless you are familiar with uses and side effects. So that's a lot to learn. That's why you have a farm course. And meds, there's a lot going on with meds, but you need to know them. So when I tell you you need to know the classifications of medications, that's how you need to start learning these processes. And then use examples of medications in that class and look, what are the side effects? What are the adverse effects? What are the labs I need to know? What is the assessment data that I need to have before, during, or after administration? And what teaching do I have to do? You want to attack each class of meds in that manner. Now, one good thing when we think about getting familiar with meds, when you go into your clinic settings and when you go to work, you are not going to carry around a Davis Drug Guide in your pocket. They have made things, especially in Epic now, fingertip ready. If you're getting ready to give a client a new med and that's come on your MAR and you verified the order, you can click on that and it's going to give you the information that you need. So it's really instant. You can learn about medications every day, but just if you're giving something new for the first time, you need to take your due diligence and understand that, because you're going to have to teach your patient about it. Then you're going to have to give it, and you're accountable and responsible for that. So learn your meds. All right, med reconciliation. This is super important, and I hope you know what this is, but if you don't, I want to talk to you about it a little bit. Um, this is a process of tracking a patient's medication as they go from one healthcare provider to another. A common time we do med reconciliation, you're coming from home and you've got a lot of meds, or maybe you don't, and you're coming into the hospital. We need to verify all of those medications. Or if we're transferring units, they do med reconciliation. Or if I'm going to my primary healthcare provider, but then I need to go to the GI doctor, they're going to do a med reconciliation, which means make sure those are the meds that the patient is taking and that they're good to go. It's very important for polypharmacy. What that is, like a lot of medications. Mainly older adults, they get many prescriptions and have many medications, so it is helpful at every and any point to do a med reconciliation so that more eyes and more brains could be on this to say, hey, if they're on 20 medications, maybe one of them's a newer one and maybe it contra indicates another one. Medication errors have been tracked in the literature to poor reconciliation. Um, Again, it's a list that lists everything the patient is taking. And again, this is going to help us reduce errors. It is a little time consuming. I'm not going to tell you an untruth on that one. But now hospitals, they're not only encouraged, they're required. This is required almost at every point of care or transfer for a patient. You do want to think about reducing errors. I think we talked a little bit about this, but we're going to go into a little bit more. You always want to make sure, and there's a movement in this, to use electronic health records. Epic is coming along for everybody, and use of e-prescriptions versus writing on a pad and give it to the client and they take it to the pharmacy. Barcoded administration, that's so you can verify and document medications at point of care. This is widely used now. Risk management departments, they examine risks and minimize number of medication errors because they're more actively involved by doing root cause analysis. And again, the root cause analysis is to determine what happened, why did it happen, and how can we prevent it. So that's how informatics really comes into play. Um, I will tell you, I have worked for a facility that was paper Mars, paper everything. I, I swear I think I had an ulcer after working there. I learned in medical records that were electronic, so that was very comfortable for me, and I feel safer with that. I went to another organization. We had electronic Mars, but we didn't have scanners. That was a very huge thing for me because I still felt like I was missing a safety step. So eventually they did get scanners and all was right in the world. But you need to understand that computers are computers. And then after this, I'll get off my soapbox. Computers only do what the human tells them to do. So please don't work around your computer processes. And if there's a problem, notify somebody that the process or the system is not working appropriately. Okay, I'm done with my little rant on that one. Let's talk about policies and procedures. I will tell you that you have to follow your policies and procedures. You do not want to not do that. If you don't know what a policy and procedure is regarding a certain thing, and this happens a lot with meds, you need to look it up and take the time to do so. Um, Policies and procedures can cover storage of medications. It is your responsibility to know that medications are being stored. I understand that pharmacy may bring them up to the unit and put them in the fridge and put them in the Pyxis or the Omnicell or wherever, but it's your responsibility to make sure that that's correct. Um, it's your responsibility to read the drug label. Do not transfer drugs between containers. We don't have that so much anymore because everything is single dose for the most part. Pharmacy usually does the stocking, so overstocking and preventing expiration, it's a dual role. Pharmacy owns some of that too, but you are the last stop standing beside the patient in their room with that medication in your hand. You need to look at the expiration dates. Monitoring compliance and abbreviations, current use. Make sure that you do not use unapproved abbreviations. If your unit has outdated reference books and over the past couple of years, many units don't even have a reference book on their unit anymore because everything is electronic. But if it's not current, don't use it. Um, and medication errors can be reduced. We always want to do everything we can to not have an error happen. And again, if an error does happen, you will do your documentation in the medical record. You will fill out your incident report and a root cause analysis will be conducted. Again, let's find out what happened, why it happened, and what can be done to prevent it. I think y'all are going to have root cause analysis down to a science by the time we're done. Oh, I hope you're not surprised by this slide. I told you we were going to do a huge amount of patient education in this course, and that's just what we do as nurses. I mean, that's what we're here. If you thought I'm not a teacher, yeah, you are. You nurses, you're going to teach all kinds of things. So just a few bullet points for reinforcement. When you are teaching your patients, one way to reduce, and this is all about reducing errors, give your client written age appropriate handouts. So you got to ask, what's their reading level? What age are they? What language do they speak? Tailor that to your client. If you can, use audio visual teaching aids, and many organizations either have a TV channel for certain things or they have links to certain things that they can go in and look on the computer specifically. You need to make sure that you have contact information in case there is an adverse reaction. Once you go through your nursing steps, notification, documentation, incident report, you do need to notify the patient and whoever their contact person is if there's an adverse reaction. Make sure you know the client, when you teach them, you know all the names of the medication. So help them with that. And they're really hard to say. I'm going to forewarn you now in this course, I'm probably going to mutilate many medication names, but we need to make sure that we teach our clients their names, teach them their side effects that could occur, how to administer the medication, how to read labels for their medication. So if you have a client that's getting discharged from the hospital, they may not have the actual medications because they're going to have to go to the pharmacy and get that. But now labels are very clear, but you'll have a sheet that will outline what's going to be on that label. You need to take this medication so many milligrams a day or tablets per day, so many times, whatever the case may be. You need to teach your client to carry a list of their medications, including over-the-counter vitamins, dietary herbal supplements. Um, I don't have a list of medications that I carry around with me. Um, but what you find is as a client has more and more medications that they take on a routine basis, it becomes imperative that they're able to have that ready available in case an emergency happens. And also, finally, teach your clients and help them if they don't understand something. Please ask. Ask all the questions that they need to ask so that you can answer them. If they have questions, they can even ask the pharmacy when they pick up their prescriptions. And there should always be a contact, your provider. If something happens, they can always contact our healthcare provider if they have one. Hey, you've made it through the end of this segment. If you have any questions, please make sure that you post them in the Prep for Exam discussion forum in your Blackboard course. And I look forward to seeing your questions come out. Thanks.